Hi, my name is Katie. This is me when I was 1 year old. As you can see, my face looks a little bit different than most children. That is because I was born with Goldenhar syndrome, a syndrome that caused half of my face to be smaller than the other. Because of the limited amount of bone in my mandible, many problems occurred that affected my speech, chewing, swallowing, and breathing. As a result, I had many surgeries growing up, many of which included procedures on my jaw. People like me, who lack bone structure in their jaw, have many different surgical options. However, these surgical procedures can be highly invasive, very expensive, and have a long recovery period. One surgical procedure is a complete jaw reconstructive surgery, where the jawbone is split, rearranged, and secured with titanium plates and screws. However, this may not always be an option depending on the strength of the bone in the mandible. Think of the mandible as the frame to a house. You need to have a solid frame in order for your house to withstand any impact. That means the jawbone must be structurally sound in order for everyday functions to occur with ease. If the structure is weak, then cutting it apart and putting it back together again will likely cause more problems than intended. Bone grafts are available to those looking to beef up the jawbone. However, similar to the previous procedure, bone grafts have long recovery periods, are typically highly invasive, and do not always work. This is a picture of me when I was 7 years old, before and after a bone graft. As you can imagine, these large distraction devices caused fairly big scars. Especially for young kids, this can be demoralizing and cause a person's self-esteem to essentially go down the toilet. Yet, these procedures are used all the time on patients with initially deformed jaws, cancerous jawbones, weak jaw structures, or involved in unfortunate accidents. But what if I were to tell you that there is a way to have reconstructive jaw surgery that is less invasive, less expensive, and has a quicker recovery period? Would you believe me? An emerging medical field that we learned about earlier this quarter is the field of 3D printed prosthetic devices. This is commonly associated with 3D printed prosthetic hands, such as the ones made by Adafruit, and 3D printed prosthetic legs made for walking, running, and everyday activity. However, 3D printed prosthetic devices reach far beyond prosthetic arms and legs. For approximately 6 years, doctors have collaborated with engineers to metal 3D print customized titanium parts that are implanted on the mandible. Susie Robinson has been positively affected by the use of implantable 3D printed titanium parts. Susie suffered a car accident that left her with many broken bones in her skull and without 4 teeth. She underwent multiple bone graft surgeries to no avail. She finally decided to have this 3D printed implant screwed into her skull. This titanium implant contains places for fake teeth to replace her missing teeth. In addition, this implant promotes bone growth, which is something she lacked before. She now enjoys a life where she can chew and talk like she did before the accident. This was a cost-effective implant that allowed her mouth to feel normal after only 1 week. This is remarkably fast compared to the months in recovery after a bone graft. Another example of using 3D printing technology for mandibular implants is the total jaw implant. In the beginning of 2012, an 83-year-old woman who had a chronic bone infection in her mandible received the first fitted 3D printed jaw. The total jaw implant is a viable choice for many patients who are ineligible for jaw reconstructive surgery. Some of these patients are people with cancer who need some cancerous bone in their jaw removed, and people who lose too much bone due to unforeseen circumstances and accidents. This titanium total jaw implant is made by a metal 3D printer that lasers 33 layers of titanium powder per every 1 millimeter in height. Clearly, high precision is a benefit of metal 3D printing. Another benefit of using 3D printed implants is that they can be easily customized for every patient. Previously, doctors used a quote-unquote one-size-fits-all implant that did not actually fit the need of every patient. Now doctors have the ability to form each implant to the specific needs of every patient. In addition to customization, 3D printed titanium prosthetic devices are significantly cheaper than the old titanium implants. For reference, two patients in South Africa received 3D printed titanium jaws, each worth $1,900. Compared to the typical price of $9,500 titanium implants, this is very cost effective. One of the only noted downsides to using 3D printed metal parts is that sometimes the patient's gums do not grow fully around the implant, making the implant less stable. However, with this advancing field, solutions are soon to come. Overall, 3D printing titanium partial and total jaw implants is cost effective, less invasive, highly customizable, and have shorter recovery periods. Had this option been available when I was young, I definitely would have preferred to use a 3D printed titanium jaw implant. Thanks for watching.